see. We have Diana. Yeah, she's waving back to me. Hello. Me, of course, and we did have the trainee in, although he was sent home earlier. Yes, he didn't really have the right attitude to work in this profession, so I sent him home. He won't be coming back. Yeah. Yes, well, sorry, I've got to go. Yeah, a new patient just walked in. Yes. Yeah, I'll talk to you later. Okay, see you later. Yes. Yes, dinner's still on. Yes. Alright, bye-bye. Bye-bye. No, I don't like that red wine. That one, no, that one tasted like licorice. Can you get the one from that place that we like? Yes. Brilliant, thank you. Yes, I'll see you at 8. Bye-bye. Sorry, so rude of me. Hello, hi, please come in. I assume you're here for hold on just 1 second. Diana. Yes, new patient. Yes. No, don't worry, I'll fill them in. Yeah, I'll do it, it's fine. You go on your break. Yeah, you've been on your feet all day, it's fine. Go. Yes. Enjoy your meal. Hi, anyway, hi, sorry, welcome, please. You comfortable? Good. So, I am going to be checking you in today for the Dr. Fang. He's the only one that's in at the moment. Yes, everyone has gone home for the holidays. So, it's just him and me and Diana over there. Did you see Diana on your way in? You didn't? Okay. Well, her job is to just welcome in the patients. She's sort of the receptionist here, but I don't mind filling in. No, it's completely fine. Yes. So, are you a new patient here by any chance? You are? Okay, no, I love to see new patients. Just out of curiosity, how did you hear about us? Word of mouth, okay. Right. Who told you? Okay, no, it's not a problem. I love having new patients. Yes, just one moment. I don't know why this has happened. Okay. It's a relatively clean book. Okay. Sorry. A Halloween prank, you know how it is. Anyway, so since you're a new patient, I fill out these cards, well, the receptionist usually fills out these cards. And what they do, because this is a private practice, we do give out rewards and benefits half the time. So I'm just going to be asking you just a few questions about your life, just to see if you fit into any of the rewards that we can give you today. And this happens to be a new pen. It's got stuff all over it though. Sorry, we're in need of a little bit of a clean in the office. There we are. Right, so can I just have your name? Okay. No, it's just I know someone by that name. Yeah. Yeah, last name? Really? Seriously? Right, okay. It's funny because this is going to sound like a weird question, right? But do you by chance know your great grandmother's name? You don't, okay. Well, I have an inkling, a very weird suspicion that she may share the same name as you. Yeah. Just a suspicion. I have an ancestry, you know that website where you can check your a picture came back of a very old lady from a very long time ago, and she kind of looks like you. Yes, not an insult, of course. It doesn't matter. But yeah, it's the eyes. The eyes look familiar. Yeah, obviously I wasn't around at that time. I mean, hello, I'm only 22. Yes. Yes. Yes, that is quite young to be working in a doctorate private clinic. However, I graduated early at the top of my class because I am just very intelligent. Yes, sorry, I'm just writing notes. Okay, could you tell me your birthday, please? Okay, so you're an adult. Good. Right. What do you do for work? Okay. Part time? Full time, okay. Do you by chance study? Are you at university, college? Okay. I'm only asking that because we do give out a rather generous student discount. That goes for nurses and doctors and engineers, sort of hard-working careers. Yes, the owner of the clinic, Dr. Fang, as I spoke about him earlier, he's a very generous human being, and despite the name, yes, and well, he likes to give back to the community. So, yeah. So, what I'm going to do is I'm just going to sign my name at the bottom. And I'm going to rip this page for you, and it's up to you to keep it, but not to put you on your shoes or anything like that, but were you thinking of coming back to us? I know you haven't even had your first test yet, but if you were to keep this and bring it back, we don't have to go through all of this again, so if you just bring it back, we do also have a website where I'll get the receptionist Diana to fill out your information on your way out. I hope that's okay. That just gives us the online forum. But I'm going to give you the handwritten one, but if you prefer the printable version, you can just go on the website later at your home and print it out. Yes. Diana, can you just put that away for me, please? Thank you. So, here's your rather sorry about the red paint. It's paint, yeah. It's been a rather busy day. We in the back room over there, we've had to we've had quite a mess, so we had to clean it up. Anyway, here, that's yours. Keep that, throw it away, do whatever you like with it. Anyway, so I think you're rather ready to go back there and get your examination sorted. You are here for a checkup, aren't you? I mean, I'm not seeing any bleeding, so yeah. Okay, I'll go and get Dr. Fang for you now. Okay. Hi, I'm Dr. Fang. Yeah, I am Dr. Fang. I don't know why I pretended I wasn't. Just a rather humorous joke. I know it's not April Fool's yet, but it doesn't have to be friendly, does it? Anyway, so you are here for a checkup, aren't you? Yes, okay, that's great. Any reason why you've come to a private clinic? You know, there are free ones here. Okay, you just want to try out something that you've got some money to spend, and you want to, okay, I appreciate that, and I thank you for coming to my business for it. I am the owner here of Dr. Fang's clinic, and yes, I'm very grateful that you've come. So, don't mind me, I do have a computer in front of me, so I am just going to be jotting down a few things that I think are rather important. You don't have to worry about if I think anything's wrong with you, I'll let you know in the process. Okay, so first things first, I'm just going to check around your head to make sure that I'm not seeing any lumps, any bumps, and if you have any pain when I feel around your areas, can you just let me know, okay? Yes, my hands are quite dirty. I don't. That's rather weird. I don't know. Once again, it's been a very messy day. You know, very, very messy. What do you mean? One moment. Diana. Hi, yes. Yes, there is red substance on my face. You didn't think to tell me that before a patient walked in. Okay. Sorry about that. No, it was a joke. I mean, I knew I had it on my face. It's a Halloween decoration, you know, I'm being a vampire. So if you could just sit still for me while I put on some gloves. You know, can't be too hygienic, although, once again, vampires are known to be very clean. And they don't carry any disease because obviously they are dead. So what bacteria can live on their hands? Yes, a joke. I'm not actually a vampire. It's called a roleplay. You know, it is Halloween, of course. Anyway, if I could just get this one on. Already. Well, yes, they are all red, but this is it's just the printable layout. You know, they're the Halloween versions. We like, because this is a private doctorate, a private clinic. We like to have fun here. Don't worry, it's not real. It's not real. Okay, don't worry. You have nothing to worry about. Okay, I promise. But if you are very concerned, I suppose I'll give you a discount on today's service for you. Considering the receptionist walked out earlier, I had a trainee doctor with me today. Obviously, he had to go home for various reasons. He was quite rude, so I sent him home. Yes. So it's been quite a busy day, and I'm quite messy, I know. So do you know what? Before we begin, Diana. Yes, hi. This patient, I just want you. This is a free service. No money. Okay, just remember that. Oh, my glove just made a weird noise. Okay, thank you. Anyway, let's actually begin with the test. So, just sit still for me. If you want, you can close your eyes. I've had various patients close their eyes. I get told a lot that I'm quite dreamy. So, yeah. Anyway, so I'm just gonna feel around your head for me, I guess, but it's to check your head. Okay. 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 Just one more. I'm just going to feel around the back of your head, okay? Okay. Right. I'm not really feeling anything. Nothing to worry about at the moment. Your hair. No, nothing about your hair. I was just saying I like your hair colour. Okay. No. No, I think everything is in the clear on your head. You didn't feel any pain during that procedure, did you? No, that's good. Sorry. So the next thing that we're going to do is, well, while we're at your head, I might as well just test out everything. So what I do have for you is, where is it? I'm going to do a taste test, okay? Some normal flavours that everybody knows, just to make sure that your facilities are working appropriately, and we also will do a smell test for you, okay? Yes, this is just to make sure that everything is working fine. You know, you never know, you might have something wrong with you and you might not even know it, so I do like to be careful here. Yeah. So, if you could just close your eyes for me, while I hand you a sweet. You're not allergic, are you? No. I'm just gonna pop it in your mouth, okay? Yeah, close your eyes. Open your mouth. There we are. Okay, just one moment. Okay, here. Yeah, spit it out. You didn't like that flavour then? It tasted like iron. I'm sorry to say you kind of failed that. This is pineapple. Pineapple coconut. 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 I don't. Where did you get copper from? Are you tasting blood in your mouth? Yes. Well, it can't be me. This isn't blood. This is, what, like I said, is red, just normal red dye. Okay, well, if you tasted blood, we'll ignore that one. I would put on some more gloves, however, we did run out. But the trainee situation got a bit messy, you see, so it required 5 boxes of latex gloves to clean up. And we're still not done, evidently. Anyway, so we're going to do a smell test now. Once again, close your eyes for me, please, and I'm just going to lift up something for you to smell, okay? Nothing potent, something very nice, okay? Once I figure out what to give you, because, once again, it's very messy. Okay. I've got it. Okay, are you ready? Okay, just breathe this in for me. See? Okay, autumn. Yes, you're getting closer. Bingo. Yes, it is cinnamon. Cinnamon. I love cinnamon. It's very nice. One of the few smells that I can appreciate. Yes. Anyway, so now that we've done your smell, your hearing, I felt around your scalp. We're going to do a hearing test next, okay? So once again, I'm going to need you to close your eyes, okay? Just really tune into your ears, okay? You know, you do not need your mouth. Don't speak. Just shush. Close your eyes and just listen, okay? Well, you're going to need your mouth open because I'm going to ask you to repeat back the words that I'm going to say, okay? In quick succession. I'm going to say a word. Let's just do a test. I'm going to whisper, okay? Banana. Yeah, you say it back, and then we do another word. Okay, got it. Brilliant. Close your eyes for me. Okay. Needle. Okay. Vaccination. Okay. Blood. Bus. Trevor. Okay. So what we're going to keep your eyes closed. So what we're going to do now is I am going to say a few words at a time. You just need to remember them and say them back to me after I'm done. Okay? Okay. Sour. Pepsi. Sweet. Desk. Sun. Rouge. Okay. You did it. Well done. We'll do one more, okay? Jogger. Swim. Trunk. Sea. Breeze. Wind. Cream. Tan. Road. Block. Yeah. Okay. Yeah, you missed block, but we'll let that slide. You can open your eyes now. So that is everything we need to do in the head region. However, it is time to bring out this bad boy. You know what one of these are? A stethoscope. You are correct. Bravo. So what I'm going to do is I'm just going to check your heart for one, and then I'm going to check your lungs to make sure that you are breathing right and appropriately and at the right time, really. So I want you to remain calm, okay? Most people get nervous at this time when their heart starts rising faster. Yes, your blood pressure. We're not going to be checking your blood pressure. We'll get Diana to do that at a later time for free, of course, if you wish. Blood pressure at this time is not very necessary. Yeah. Plus, I have this weird sense to kind of just know your blood pressure. Yeah, so, and I can tell you you're doing pretty fine. I can also, I don't really need this for your heart, but, it's a mandatory thing for clinical procedures, so, yeah. So if you could just sit still for me while I check your heart rate. Okay. Right, okay. Yep. Yeah. I know this is a bit awkward, this part, but it is, necessary, I suppose. Okay. Right, okay. Okay, that was your heart. Your heart is doing pretty good. If you'll just excuse me for a second, I'm just gonna quickly type some things. Okay. Okay. Right. Now I'm gonna check your lungs. Excuse me, sorry. Okay, breathe in for me. Let's do it together. And now out. Okay. Take a shallow breath in. Don't let it go. Okay, now out. Okay, we're gonna do one more. Okay, one more. Just breathe in normally for me. Keep it in. And let it out. Okay. Well, I am glad to say that your lungs are working perfectly fine. They don't hurt, nothing like that. No, okay. That's good. So, another thing that I do ask my patients is, obviously, we send out alerts when there's a checkup, but since you're a new patient, you wouldn't have gotten that checkup alert. So, one of the questions that I do ask for new patients is, what made you get a checkup? Do you have any health concerns that you're afraid of? Just any sad thought in your mind that made you want to come here today? Okay, your stomach. Okay, what's wrong with your stomach? Okay. Alright, I'll check it out for you. If you could just lay back a little bit and roll up your shirt. Right. Okay, you can sit back up now. I'm seeing your appendix looks a little bit inflamed. Nothing to be worried about. I do think you just have a little bit of an infection. Okay, nothing to worry about. We're going to put you on some pills that you can grab from the pharmacy next door. We own a pharmacy as well, a private pharmacy. Obviously, we'll give you them to free, Diana. Yeah, you know it already. Thank you. She's been listening, cheeky. So yeah, you just go over there after the exam, after Diana talks to you for a while, and then you can go and grab them for free, okay? You need to take them every day for around 2 weeks, and that should die down. But if you are still experiencing the swollen belly, just come back, okay? Ask for Dr. Fang, okay? There are other doctors in this hospital if you're not pleased with me, but it's a lot better for a doctor to see their patients and not go to another one, if you understand. Yeah. So another thing that we do offer is we do give out vaccinations. Were you looking to have a vaccination? Because we are not a government clinic, we are a private clinic, we have our own rules here. offer a very special vaccination. A very, very, very special vaccination that is very likely to cure most of your human ailments. But we only give it out to special patients, ones that are in dire need of care, ones where pills and IVs and any kind of human procedures and surgery aren't likely to fix the problem. Now, this is very expensive, I won't lie to you, but it is very beneficial, shall we say. You don't want that, that's completely fine, completely up to you. However, I would like to just show you the vaccination, just to show you what you're missing out on, just in case you're scared of it, which is completely fine reaction. It is a big needle, but the liquid inside is something we call yeah. So this is what it looks like. Very red. Yes, it looks like blood. It is a form of blood. Yeah. No. You don't understand. A form of blood. It's special blood, shall we say? It's very, very, very scientifically proven, shall we say, to fix human needs. But we get it from a source, a very, very rare source that even governments and scientists don't really know about. We know about it because, well, I've been a doctor for very many, 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 many years. I used to be a scientist once. Did you know that? No. Yes, I know. I told you I was 22. But I started at a very young age. Let's just say that. Anyway, I believe that concludes the test for today. However, we do like to give various gifts to our patients every now and then. So, for one, I am going to be giving you long-lasting fragrance of Lynx Epic Fresh. Not to say that you smell bad, you do not smell bad, don't worry about that. However, to the noses of heightened senses, let's just say that you have a smell that is how do I explain this? But just put it on. Okay. You will thank me later, especially if you walk around at night, especially in this season. Another thing that we give is some face wash. Once again, I'm not saying it unhygienic. This is purely because I am noticing just a few flecks of dry skin on your cheeks. Yeah, well, I have quite good vision, so I can see it. And this is our own formula. I personally went with the team that developed it, and I promise you, it does its thing. It does a thing, So that's for free. I'm just gonna give that to you right there. We do have a few other gifts that I do not give you. Diana goes out of her way to get them out of the storeroom. So if you have any other questions. Yeah, I know today has been very weird, very messy, I know, but what can you do? Yeah, if you're ever interested in that vaccine, just let me know, okay? You should have my number on the paper that I filled out for you, or you can just ask Diana, or log into the website and you'll have our contact information on there. But I'm pretty sure that concludes the test. Yeah, you have a good day now. Have a good night as well. Yes, about him. He was very rude. Okay, he was very rude to Diana, so I had to get rid of him. Yes, I know. Your services are expensive. But it's not like I can finish the whole thing, you know. I don't eat the meat. You know, I only drink the liquid. I don't know, is there a zombie